Hi, Joydeepa, nice to see you. Can you tell us a bit about where you are and what your role is?
Hello, Jill. It's good to see you and talk to you. I'm a doctor, I'm a physician, and I work for the Leprosy Mission. Been here for long years, for about 19 years, working in the hospital. Now, heading the research, training, monitoring, and evaluation department, living in Delhi. Most of my life, I have lived in a hospital and looking after patients, caring for leprosy affected patients and people with leprosy complications, ulcers, children with leprosy. So that's what I've been doing these years.
So how is COVID-19 affecting your work?
Well, COVID-19 is affecting all of us, isn't it? And definitely the work that we do involves people who live in the cities, in the rural areas, in the villages, in the communities. And COVID-19 has imposed a complete lockdown in our country. And with this lockdown, people are unable to travel. They are unable to access treatment because specialty leprosy treatment is available only at few centers, and people are suffering. People are not able to come. People are not able to continue their medications because this lockdown has been over a month now, and we have another 2 more weeks to go, and we don't know what's the future after this. So patients are worried. Patients are, some of them have called, and many of them are anxious, not only about their own disease, but also about what COVID-19 is going to affect them, how they are going to cope. So, it's a worrying situation, and the people are suffering out there.
So what does that mean for the treatment of people with leprosy? If they can't access treatment, their conditions are worsening?
Yeah, yes, I would say that in case they are not able to access treatment, some of them will discontinue. But some of them who are on medications for reducing their disability, the anesthesia of the palms or weakness of the hands and feet, if they are unable to access that, then, the obvious answer is yes, their disability would increase, and which is worrying again because you don't want people to live on with disability. So complications, there may be people who are getting the reactions, who are getting ulcers and worsening of ulcers because they are not able to access dressing facilities, So in a way, yes, they would be suffering, and they would have increased burden of leprosy.
Yeah. I think you were going to tell us a story about an individual.
Yeah, I'll show you some pictures of children and patients. If you see them, you'll understand what I mean. Like this young mother with a little child whose mother detected with leprosy, and the child 7 months later, and both of them are on medication. And a mother and a child definitely cannot come on their own, so they probably will need a male family member to come with them. And in these lockdown days, who can travel? Neither public nor private transport is available. The other kind of work that we do is research. And if you look at research, we have the proposals, the work that we do is all from the field, the sample collection. Here you can see the lab staff are collecting samples in their villages from people affected by leprosy, their contacts, their family members. And if travel is banned, travel is not allowed in COVID, then, we cannot conduct these research studies. Deadlines will cross, we will not be able to produce results. So travel, this lockdown has imposed this, and then I don't know how much we can go to these communities with maintaining social distance and then collecting samples. So we will require personal protective equipments, and they don't come cheap. So we would need to gear up for situations post-COVID also.
Yeah. And how important is it that people here in Scotland continue to support the fight against leprosy by donating?
Yes, the Scots can definitely continue in their support. They should continue supporting the fight against leprosy. Scotland has done a lot and has done quite amazing campaigns. And we believe we know that with the number of patients coming down, work in leprosy is going to really suffer. Access to treatment is going to become difficult for their people. If public transport is not allowed, getting private transport is going to be tough. So what we propose is to some way go into the community to give medicines, somehow get people to come, somehow do telecounseling, telemedicine. These are all our future plannings, and we need a proper equipment to bring patients to us. If we have to stay safe, we need to keep them safe. We need to provide them with masks. We need to provide them sanitizer. We need to protect ourselves by wearing the mask and the gown. All these can be funded and need money to buy. So procuring this is expensive. So there are a lot of things that need immediate attention right now. So I believe that in this fight, the Scots could join us, so that along with COVID, I mean, in the COVID-19 situation, we keep our patients free of COVID, free of ulcers, free of disabilities, and help them to access and get better treatment.
Thank you, Joydeepa. Thanks for giving us an insight. It's been really good to hear from you.
Thank you so much. It was a pleasure. Thanks.